Hello and welcome to the Health Tech Narrative podcast. Today's episode is great. It's something that I wanted to do for a very, very long time. We have Dr. Indu Bhushan with us, who is the ex CEO of the NHA. He's agreed to join onto this podcast to speak about a number of things, including India's digital health ecosystem and where it's at right now. And I think this is a very pertinent conversation for the times we're in, and for the fact that healthcare and health tech in India need an upgradation. And I'm very happy to have you on this podcast, Dr. Bhushan. Thank you so much for joining.
Thank you, Divyam. I'm really delighted to be with you, and I'll share whatever I know about the questions that you have.
I just wanted to sort of have this opportunity to understand your background. You were at the IIT, and now you've become one of the leaders in global health. And your career journey is incredibly fascinating. You've been an IAS officer. You've had your tenure at the World Bank and the Asian Development Bank, and eventually leading Ayushman Bharat as its CEO. So, could you take us through this journey of yours?
Thank you, Divyam, and glad to be speaking to you. And you are absolutely right that I've had very unique journey, professional journey, and very fascinating one. I've been extremely fortunate that I got several breaks and which took me to all these places. I've lived in three places, three different countries, and for a long time. And I have visited more than 80 countries, and most of them for work. So I find myself extremely fortunate having done that. And you're right, my journey from IIT to Ayushman Bharat has been a long one. I was in the IAS Rajasthan cadre. Before that, briefly in UP cadre. I had to change to Rajasthan because my wife was in Rajasthan, and that was a big change, for my family, because I come from UP, and in UP, if you have an IAS officer as your son or relative, that's a huge thing. And I was leaving UP and going to Rajasthan, so no one was happy. But they were in for a bigger shock because I also left the IAS later, and I went to first do my PhD at Hopkins, Johns Hopkins, health economics, and then I was with the World Bank, worked there in Washington D.C., and then I came to Asian Development Bank, where I was there for 21 years, and I was involved with many of their leading projects. I was Director General for Strategy and Policy, and I was the only non-Japanese person to become DG for Strategy and Policy. ADB has a very strong Japanese influence, and some of the key positions, and DG of strategy is considered very key because the person not only uh, decides the strategy of the bank but also allocates resources across the bank. So I was there, and I was very fortunate and really enjoyed that. And then I was in charge of DG for East Asia, and looking after many countries, including People's Republic of China. So it was a fascinating experience working with China and dealing with the top policy makers in China. It was also very uh, learning experience for me because China, what they've done in the last 30 years is really remarkable in all different fields. And it was 2018, early 2018, and it was out of the blue that I get this call from Prime Minister's office that Prime Minister wants me to join and implement Ayushman Bharat. And of course, once you get a chance like that, it's a once in the lifetime thing that any professional can ask for. So of course, I said yes, but they wanted me to join the next day, and I said, I am leading a department here, and I am dealing with China, and I really can't up and leave. I have commitments here, and so I negotiated 4 days. That within 4 days, I was here. My wife later packed and came and joined me, but and then I was so happy and so fortunate that I got this chance and opportunity to uh, establish National Health Authority, uh, start, design, and implement Ayushman Bharat, and later on do the pilot and start National Digital Health Mission, which became Ayushman Bharat Digital Mission later. So I consider myself among the most fortunate and lucky professionals who've done all different things. So the kind of things I've done, I've worked in Vietnam extensively, China, Thailand, and Central Asian countries. Worked in the World Bank. Worked before that in IAS in Rajasthan as collector, and then ultimately last position was Ayushman Bharat and Digital Mission. So it's been a really very fascinating journey where I've learned a lot, and I've met with a lot of exciting people, young people like you, Divyam, who have actually taught me a lot. Hmm.
Right. I'm sure it's the other way around. I'm sure you're the one who's doing all the teaching. It's a fascinating journey. I'm sure you're saying that you're lucky, but I believe just hearing that there are a few it does not come without risks, because I think leaving the IAS service can be seen as something that is pretty shocking.
My wife has been very supportive, but at times she's been very exasperated with my moves. And when I was trying to move to the US for studies, and she didn't understand why we have to leave a very cushy life. I used to be the district magistrate collector of Dosa, and a huge house and
Yeah.
a lot of support. And then I go as a graduate student where I was living in dorm, which was half the size of my maybe guard box in my house. And so people were saying maybe I think there's something wrong with his mind. Maybe sometimes people lose their mind, and maybe that's what's happening to this guy. And then I left the World Bank and came to Asian Development Bank. That was also not seen as a very proper move. People said Washington D.C. is a much better place to live, and World Bank is a better place to work at. And again, I'm glad that I moved to ADB, because that gave me much more flexibility and opportunities. And again, leaving ADB when I was at the top of the game and coming here, people say, "Oh, here he goes again doing that." But frankly, Divyam, if I have to do all of this all over again, I'll do exactly what I did, because I think finally, unless you take chances, I think you don't gain any much. And I used to say that, if you're not living on the edge, probably you are taking too much space, and that's what comes out.
It's clear that you've had a very a diverse educational background. I want to understand how this is your perspective on healthcare services and health economics. Is how has that shaped your perspective of developing healthcare, particularly in a developing country like India?
Hmm. I have to be very frank that while my initial work in IAS was in health, and that's how I got interested in health, and that's why I did my PhD in health economics from Johns Hopkins, which is considered one of the best universities on public health. And with the World Bank, I was working in the health sector in Nigeria and Ghana. And I joined ADB as a health specialist, and I was in the initial 5 6 years I was in the health sector, and I learned a lot from the health systems in Thailand and Vietnam, which still remain one of the model health sectors in the world, not only in Asia. And so the way they have privatized health and the way they financed health, the way they have achieved these health outcomes, which are much higher than people or countries at the same level of per capita income, is something to aspire for. And same thing is applicable for China. And China is fascinating in the sense that they used to have very high level of health indicators and a very strong health system. And all of us have heard about barefoot doctors and how they provided the public health to rural areas. But when they started opening up after 1989, there was a period of 10 years when there was a big problem. And they realized that at the time of SARS in 2004, and the shock of SARS actually, they were at the same level as we are now, and they realized that they need to put in much more money. And uh, after that, they've made the systems much stronger, and they've started putting in a lot of money. They've increased their state funding by more than 100%. And now, in terms of the health indicators, they've come back as the pre-liberalization days. And in terms of out-of-pocket expenditure, they've gone down. In terms of quality of services, they're improving. In terms of catastrophic health impact and universal health coverage, I think a lot of progress has been done. So I think there are lessons from all over the world, and maybe in India we can learn from those countries, even though those countries may be small and not as diverse and complex as India.
I mean, if you're saying that when SARS had hit China, they were at the same level as India is right now. I'm assuming it's in terms of the system, the healthcare system. China's model could be something that India could follow. It's not undoable. It's
Hmm.
not. It's not something that cannot
No,
be.
no, it's entirely doable, Divyam, because what they've achieved is in 10 years' time, they've increased the proportion of people who were covered for healthcare against catastrophic health illness uh, to almost about 80-90% from a very small number in 2004. So I
Wow.
think within 10 years, if we have a plan, we put resources, uh, we can achieve the levels of what China has, and maybe surpass that. Mm.
When China opened up, the health infrastructure took a hit. What is it about opening up economy and liberalization per se that could affect a healthcare system? Because that's a connection I can't draw.
So the issue is that uh, healthcare is something which has a lot of elements of public good. So it has to be provided by the government, because private sector will not have incentive to provide those services. For example, take immunization, take health education, take preventive health. All that requires very strong state intervention, and we have to provide those services. That's one issue. Second issue is that there has to be a system where everyone has access to health services, not only access to health services, but quality services which are affordable. And so providing quality services which are affordable uh, is something that government has to ensure, because if you just leave it to the private sector will be coming from profit motive, and they don't have any incentive to provide quality services where there is no paying capacity. And that's you can see in India, eight large cities in the country have most about 80% of tertiary healthcare. And that is also because of the same thing, that these are the places where there is paying capacity. It's easier for private sector to get doctors and create those facilities. And that's why large proportion of population will not have access to these services. Even if they have access to these services, most of them can't afford it, right? So the government has a role to play in terms of making them affordable. And there are many models how government can play a role. Now, traditionally, one can follow what UK has done, a national health service model where government provides all these services, and it's free, and basically all the services are being financed through tax. And then, but there could be other models which have been followed now in China and other countries where it's both public and private sector which are providing services. But in terms of buying services, there is a compact which is between the whole society where no one is being denied services because they pool funding. And let me just unpack what pooling means. Pooling means that the sick people are using services, but they are not the one paying for services exclusively. There is a compact that is being subsidized by government. It's being subsidized by healthy people. Services for elderly is being subsidized by young people, and poor people are being subsidized by rich people. So, for example, if everyone is part of, say, I'm just taking one extreme example, is part of one health insurance scheme where everyone is paying premium, and premium is proportional to say what the income is, then everyone is covered and everyone is paying for it according to their means, and they're using services according to their needs. So that kind of system where there is a compact in the society which is based on a progressive premium that everyone is paying and the services being available to everyone is what we need to achieve. So now there are many ways in which we can
Models.
provide these services, and India has to see, or our
Which
country has
one?
to
Yeah.
see, which is the best model for us.
So in the pooling model that you just mentioned, that's something where you like it's progressive, premium. It
Mm.
depends on how much income you have, but there is no discrimination based on the kind of healthcare services that one can
Yeah,
get.
yeah.
Okay, all
See,
right.
if you take NHS, their pooling is done through taxes.
Yes.
So rich people are owing more tax, and poor people pay either no tax or very small amount of tax. All that tax income is used for providing services, and everyone is
Services.
covered, right?
Yes.
And it could be supplemented by, say, another system where there's a health insurance which is provided either by the government but also could be through private insurance, where a premium is charged. For poor people, government can pay the premium. For near poor, probably they can pay small amount of premium, and rich people will pay the whole premium,
Open.
and
Yeah.
then they can use services both in the public sector and private sector, right? So some sort of a system can work. So going back to your original question, why in a free market health system does not work? It is because government has to have a role in terms of equalizing the access to services, and also in terms of ensuring that poor people can afford services, and they when they need it, and sick people can afford services, especially the catastrophic health expenditure is covered by someone.
Correct. Just quickly, do you think the U.S. healthcare system is an example of healthcare in a free market?
Yeah, U.S. health system is an example of what we should not follow,
Yes.
because I think there are large distortions there, and where the cost has gone through the roof. At the same time, quality has not improved, and it's extremely difficult to get appointments, and so coverage of services is extremely poor. So
Poor.
I think
Yes.
uh, US can be an example of what not to do probably for India. Mm.
Absolutely.